Diving into something that sounds like it's straight out of science fiction. Creating a digital twin of your cardiovascular system. And not just any twin, one that actually evolves with you over time. We're talking about cutting-edge research on the Longitudinal Hemodynamic Mapping Framework, LHMF for short. And let me tell you, even I was blown away by the possibilities.
It's truly groundbreaking. Imagine having a personalized simulator, like a virtual replica, of your heart and blood vessels, capable of simulating millions of heartbeats, 1,000 times more than traditional models. That's the power of LHMF, and it could change how we approach heart health forever.
Okay, so we're not just talking about like a snapshot of your heart, but like a dynamic, constantly updating view of your cardiovascular system. But before we get ahead of ourselves, let's back up a bit. What's the problem that LHMF is trying to solve? Why do we need this kind of technology?
Well, cardiovascular disease is one of the leading causes of death globally, and existing models just aren't cutting it. It's like trying to understand a novel by reading a single sentence. You miss the context, the nuances, the overall story. LHMF aims to change that by providing a far more comprehensive and personalized understanding of your heart health.
So it's like going from a blurry black and white photo to a vibrant high-definition movie of your cardiovascular system.
That's a great way to put it. LHMF uses something called the discontinuous Callerkin method, which essentially allows to handle the complex geometries and flow patterns of your heart and blood vessels with incredible accuracy. Think of it as creating a highly detailed 3D puzzle of your cardiovascular system, where each piece represents a tiny section of your arteries and veins.
This means your digital twin isn't just a static image, but a dynamic, living representation of your cardiovascular system, capable of simulating blood flow with remarkable precision. And here's where it gets even cooler. LHMF doesn't just simulate in isolation, it actually connects to your wearable devices.
Exactly. Your fitness tracker, smartwatch, even that blood pressure monitor you use at home, they can all feed data into LHMF, creating a truly dynamic digital twin that evolves with you. Imagine your doctor having a real-time dashboard of your heart health, not just a snapshot from your last checkup.
Hold on, you're telling me my fitness tracker could be helping to create a digital twin of my heart? That's wild. But all this simulation, all this data, it must require a ton of computing power, right?
You're absolutely right. LHMF relies heavily on high-performance computing, or HPC. To handle all those complex calculations, think of it as giving your heart's digital twin its own supercomputer to crunch all that data.
Makes sense, but how do we know this thing actually works? Have they tested it?
Rigorously. They've tested it with synthetic data, in vitro experiments, and even clinical data from real patients, and the results are impressive. LHMF has demonstrated high accuracy in predicting blood flow patterns and pressure changes, often with less than 5% error. And it's significantly faster than traditional methods, completing these complex simulations in minutes rather than hours or days.
So they've got the data, the computing power, and the accuracy. But how is this information actually used? Is it just a bunch of numbers on a screen?
Not at all. LHMF integrates with virtual reality, allowing doctors to visualize your cardiovascular system in 3D. Imagine your doctor being able to virtually walk through your arteries, seeing those blockages or areas of weakness up close and personal. It's like having a Google Maps for your heart, but way cooler and with potentially life-saving implications.
Wow, that's amazing. I'm starting to see why this is such a big deal, but like with any new technology, there must be challenges too, right?
Of course. One of the key challenges is computational complexity, even with high-performance computing. Simulating millions of heartbeats with high accuracy can be resource-intensive. Researchers are constantly working to make LHMF more computationally efficient, exploring new algorithms and techniques that can speed up those simulations without sacrificing accuracy.
So it's a balancing act between computational power and clinical practicality. What are some other challenges they're facing?
Data integration is another big one. Wearable devices are great, but there's still a lot of variability in the type and quality of data they collect. LHMF needs to be able to handle that messy data landscape and make sure it's extracting reliable and meaningful information. Think of it like having a team of expert translators, making sure all that data from different devices is speaking the same language.
It's fascinating to think how this all comes together. We've gone from static models to this dynamic, evolving digital twin, all thanks to the power of HPC and this constant flow of data from wearables. It's incredible to see how technology is reshaping healthcare right before our eyes. But we've only scratched the surface of LHMF. This is the deep dive. And trust me, we're going even deeper.
We'll be back right after this short break to explore the intricate mathematical and computational techniques that make LHMF possible.
Stay tuned. All right, we're back. I'm ready to dive even deeper into the world of LHMF. We've talked about the big picture, but now I'm curious about like the nuts and bolts. What are the computational techniques that make this whole thing tick?
That's where it gets really fascinating. Remember how we talked about LHMF simulating blood flow with incredible accuracy? Well, to do that, it uses something called the discontinuous Galerkin method, or DG for short.
DG? It sounds a bit intimidating. Break it down for me. What's so special about it?
Imagine you're trying to build a super detailed 3D model of your entire cardiovascular system. DG is like having a special set of tools that lets you create that model with incredible precision. Instead of using physical building blocks, it uses advanced math equations to represent every tiny curve and bend of your arteries and veins.
So it's like a digital sculpting tool for your heart and blood vessels.
Exactly. And it's especially good at simulating fluid dynamics, which is all about how liquids, in this case your blood, flow, and interact with their surroundings. This is crucial for creating a digital twin that accurately reflects how blood moves through your unique cardiovascular system.
Okay, I'm starting to see the power of DG. But we also talked about LHMF using real-time data from wearables. How does that fit into this complex computational puzzle?
That's where the brilliance of the Kalman filter comes in. Think of it as a super smart detective that's constantly comparing two sets of information: the predictions from the LHMF model and those real-time measurements from your wearables.
So it's like having a fact checker, making sure the digital twin stays in sync with what's actually happening in your body.
Precisely. The Kalman filter takes the best of both worlds, the theoretical model and the real-world data, and constantly refines the digital twin, ensuring it's always reflecting the most accurate and up-to-date picture of your cardiovascular health.
This is mind-blowing. It's like the digital twin is constantly learning and adapting, just like our real bodies do.
And here's the best part. The Kalman filter doesn't just blindly average the two sources of information. It's much more sophisticated than that. It assigns weights to each data source based on their reliability. So if your wearable's heart rate measurement is super accurate, the filter will give it more weight when updating the digital twin.
So it's like a personalized weighting system, constantly evaluating which data to trust more. But what if there is some uncertainty in the measurements? Does the Kalman filter just ignore that?
Not at all. In fact, it embraces the uncertainty. The Kalman filter actually provides an estimate of how confident it is in its predictions. This means your doctor won't just see a single number, but a range of possibilities, allowing for more nuanced and informed decision-making.
Wow, it's incredible how much thought and ingenuity has gone into creating this technology. But ultimately, it's all about improving human health. So let's shift gears a bit. What are the potential benefits of LHMF in the real world?
The potential is vast. It's incredibly exciting. One of the most promising applications is in personalized treatment for cardiovascular disease. Imagine a world where treatment plans are tailored, not just to your condition, but to the unique dynamics of your cardiovascular system.
So instead of a one-size-fits-all approach, we could have treatments that are as unique as our fingerprints.
Exactly. Let's take coronary artery disease, or CAD, as an example. Traditionally, treating CAD involves a lot of guesswork. Doctors use imaging techniques to get a visual estimate of blockages, but with LHMF, they can actually simulate blood flow through your arteries, seeing exactly how those blockages are affecting blood flow in your heart.
It's like having a virtual magnifying glass that allows doctors to see those blockages in incredible detail and understand how they're impacting your specific heart. So it's not just about diagnosis, it's about guiding treatment decisions in a much more personalized and effective way.
Precisely. Let's say you're a candidate for a stent procedure, where a tiny tube is inserted to widen a narrowed artery. LHMF could be used to simulate that procedure beforehand, allowing doctors to see how different stent sizes and placements would affect blood flow in your heart.
Wow, so it's like a dress rehearsal. For the actual procedure, doctors can fine-tune the treatment plan before they even touch you, minimizing risks and maximizing the chances of success.
Exactly. And the benefits go beyond planning. Imagine wearing a heart rate monitor during a stress test. That data feeds into LHMF, showing your doctor exactly how your heart is responding to exertion and whether those blockages are causing any problems.
This is incredible. It's like having a virtual window into your heart, allowing doctors to personalize your treatment in ways we never thought possible.
And it's not just limited to CAD. Researchers believe LHMS could be used to manage hypertension by simulating how different medications affect your blood pressure, assess the risk of aneurysms by analyzing wall stress in your blood vessels, and even predict the effectiveness of heart valve replacements based on your unique anatomy.
It sounds like LHMF could usher in a new era of personalized cardiology, where treatments are as unique as the patients. They're designed to help. But as amazing as this technology is, I'm sure there are still challenges to overcome.
You're right. We've touched on computational complexity and data integration. But there's another aspect we need to consider: making sure LHMF is accessible to everyone who could benefit from it.
That's a crucial point. It's not just about developing cutting-edge technology. It's about making sure it reaches all corners of healthcare and doesn't exacerbate existing disparities. We need to ensure LHMF is available to everyone, regardless of their background or socioeconomic status.
Absolutely. The future of healthcare depends on making these incredible advancements accessible and equitable for all.
Well said. It's been fascinating to delve into the technical intricacies of LHMF and see how those translate into real-world benefits. But we're not done yet. This is the deep dive, and we're about to take our exploration to the next level.
In the final act, we'll shift our focus from the present to the future, exploring the emerging trends that could shape the next generation of LHMF and revolutionize cardiovascular care as we know it. Stay tuned.
Welcome back to the deep dive, where we've been exploring this revolutionary technology called LHMF, a personalized digital twin for your heart. We've covered the what and the how, but now it's time to get into
the really mind-blowing stuff. The future of LHMF. You're absolutely right. We've only just scratched the surface of what's possible. What if we could push the boundaries of LHMF even further? Unlocking potential, that sounds like science fiction today.
Okay, now you've got my attention. What kind of science fiction are we talking about here?
Imagine LHMF, not just simulating your cardiovascular system, but actually learning from it, identifying patterns, and making predictions that go beyond our current understanding. We're talking about integrating machine learning